The truth is, one of the hardest parts about retiring before age 65 isn't walking away from your job, figuring out what you'll do with your free time, or even making sure you've saved enough money. It's about solving the expenses associated with your healthcare. Let's say you want to retire at age 62. That 3-year gap between when you stop working and when Medicare kicks in at age 65 can completely change the math that's required to make your retirement work effectively. You simply must have a plan for this. I've seen couples who were unprepared for this get completely stressed out, even though they thought they had everything figured out. So today we're going to talk about what this healthcare gap really looks like, how to plan for it, and I'll even show you an example of how we helped one couple save tens of thousands of dollars by being strategic with their income, their tax planning, and Roth conversions. My name is Brad Pistole, and I'm a retirement income certified professional dedicated to helping people retire all over this great country. If you'd like to see what my team and I would do for your specific retirement income plan, just visit our website at ozarksretirement.com and fill out the Contact Us form. I will personally reach out to you. Now let's start with why this problem exists in the first place. For most people, healthcare during your working years is simple. Your employer covers most of it, you pay a little each month, and the costs are fairly predictable. But when you retire before age 65, this safety net disappears. You see, Medicare doesn't start until you hit age 65, and if you retire before this age, you're on your own for your health insurance. That means you either have to buy coverage through the Affordable Care Act marketplace, find COBRA coverage through your old employer, or go uninsured, which is not something anyone should do. Now here's the part that shocks most people. A couple in their early 60s might pay anywhere from $1,200 a month to $2,500 a month for health insurance if they just go to the marketplace and sign up without a plan. That's $15,000 to $30,000 a year before deductibles, before copays, and before prescription costs. For someone trying to live on $70,000 to $80,000 of income a year, that's a huge bite. But what many people don't realize is that the cost of those premiums depends heavily on your taxable income. That means how you'll pull money from your accounts. Things like your IRA, Roth IRA, Social Security, or brokerage accounts. They can literally determine what your healthcare costs will be. If your income is too high, you lose valuable subsidies under the ACA. But if you plan correctly, you can potentially keep your premiums much lower. So let me give you an example of how this works. Imagine a couple named Tom and Susan. Tom is 62 and Susan is 61. They live just outside of Springfield, Missouri, and they've worked hard all of their lives. Between Tom's 401k, Susan's IRA, and a joint brokerage account, they've done a great job of saving about $1.2 million. They own their home outright, and their plan is to spend about $80,000 a year in retirement before taxes. They want to retire now and enjoy a few years of freedom before turning age 65 and starting Medicare. When they first came to see us, they were planning to take $80,000 of income straight out of Tom's 401k. Well, this seems simple, right? They'd pay a little bit in tax, cover their expenses, and they should be fine. But when we looked at what that meant for their healthcare premiums, the plan quickly fell apart. Pulling $80,000 from a 401k meant reporting $80,000 of taxable income, and that instantly disqualified them from any ACA subsidies. Their premiums were quoted at over $1,900 a month. That's almost $23,000 a year in premiums for coverage that didn't even really meet their needs. Now here's where great planning changes everything. Instead of drawing all of their income from the 401k, we built a layered withdrawal strategy that completely transformed their situation. First, we started by identifying how much income they actually needed to show on paper in order to qualify for premium subsidies under the Affordable Care Act. Based on their ages and their specific situation, we determined that keeping their modified adjusted gross income under roughly $70,000 a year would unlock substantial premium assistance. So we reorganized their withdrawals. We decided that roughly half of their income would come from their taxable brokerage account, where withdrawals are considered a mixture of both principal and capital gains. That means only a portion of these withdrawals count against income for subsidy calculations. Then we use their Roth IRA, which we had been building through partial Roth conversions over the past several years to pull out another chunk of completely tax-free money. Finally, we took just a small amount, about $15,000, from their traditional IRA to give them the total income they needed for the year. By coordinating these three sources and allowing them to work together, the brokerage, Roth, and IRAs, their taxable income dropped from $80,000 a year to just under $65,000 a year. And here's the amazing part. When we reran their health insurance quote, their premiums dropped from almost $1,900 a month to about $420 a month. That's over $18,000 a year in savings. The same coverage, the same lifestyle, just smarter tax coordination. And we didn't stop there. We also built a multi-year Roth conversion plan. The goal was to move about $50,000 a year from their traditional IRAs into their Roth accounts during those first 3 years before Medicare. Now, why would we do that? Because while they were keeping their taxable income low for ACA purposes, they still had room in the lower tax bracket to convert at the 12 to 22% tax bracket. That means less taxable growth in their IRAs, smaller required minimum distributions later, and more tax-free flexibility once they hit age 70 and beyond. Now let's fast forward 3 years. Tom and Susan are both age 65 and now they're on Medicare. Their taxable IRAs are smaller, their tax-free Roths are larger, and their lifetime tax liability is much lower. Their Medicare premiums are based on lower income levels because we manage those conversions carefully. Now they both have peace of mind and control. And that's the real story here. Retiring before age 65 can absolutely work, but you can't wing it. You can't just say, oh, we'll pull from our IRAs and see what happens. You see, every dollar of income has a ripple effect. It affects your taxes, your healthcare premiums, your Social Security taxation, and even how much of your Medicare premiums you'll pay later. That's why when we build income plans for clients who want to retire early, healthcare planning is always one of the first conversations we have. We build projected ACA scenarios, we coordinate income sources, and we map out Roth conversions for each year leading up to Medicare. It's not just about saving money, it's about avoiding those nasty little surprises that can derail your plans. So here's the bottom line. If you're thinking about retiring before age 65, don't just focus on the bottom line of income that you need. Focus on the type of income, where it comes from, whether or not it's taxable, and how this can affect your healthcare premiums. The difference between a smart plan and a casual plan could easily be between $50,000 and $100,000 in savings over those very few short years. Hey, if you'd like for us to help design a retirement income plan that bridges the Medicare gap the right way for you and your family, balancing taxes, income, and healthcare costs, just reach out to us at the contact information below. That's exactly what we do for families all across the country, and it can make all the difference in how confident and secure your retirement feels. And as always, don't forget to like and subscribe for more videos just like this. They're all designed to help hardworking people just like you retire smarter, safer, and with more peace of mind than you could ever think possible.